presentation by Healthy Leadership CIC. Mental health in the workplace. Mental health in the workplace is important, even more so as we recover from COVID. But most interventions focus on helping the individual employee improve their self-care, and sometimes enable them to have access to training and counseling. Organizations must also ensure that their culture and infrastructure encourage well-being and mental health. Otherwise, they're at risk of trying to fix the person who may be coping as best they can. It's pointless to have a well-being and mental health strategy if negativity and toxicity are paramount. Second, it is important to make sure that the interventions are useful and needed. There's usually only about a 30% uptake of such programs. Ask people about the organizational culture and structure in terms of how supportive these are towards well-being and mental health. What interventions do they need? They will need assurance that they can access some of these in confidence, that there will be no reporting back to managers or the organization beyond saying how many use the services. Staff these days are very knowledgeable about well-being and mental health. Some may even have expertise, so why not involve them? For example, by creating a well-being group or network where they share knowledge and skills. Some organizations have mandated that managers ask their staff as part of supervision, "How are you?" While well-intentioned, this question provokes a conflict. Organizations should not delve into private matters of employees. We can say, "How are you? Is there anything that we can help with?" For example, offering flexible working so that the staff member can go with their relative to healthcare appointments. We should not expect to know about that relative's illness. A better approach is to recommend that all staff develop a self-care plan. Give access to specialist help to create the plan, such as talking to a counselor or clinical psychologist. The manager can then ask them to affirm that they have developed the plan and ask if they need any help. Then regularly, the manager can also ask the staff member to confirm that they are following the plan. The organization also needs to make sure it is promoting collective accountability, where staff are openly praised for their work, where there is permission to admit to faults without recrimination or blame, where negativity can be mentioned and addressed with sensitivity. We should help managers to develop supportive and empathic skills so that they can recognize when someone could have some problems. They can then direct the person to services. Review every aspect of the organization: policies, procedures, administration, human resources, service delivery, commissioning, supply chains, and customers, to make sure that all elements are supportive of staff regardless of their mental health and well-being. An organization should be able to support 3 categories of staff: people who are mentally healthy and at work, those who have some mental health problems and/or physical health problems and at work, and people who become ill, need to be absent to receive specialist help and then return to work. People will move across these categories. The organization will improve mental health if these elements are present, operational, and trusted.